Right. So just let me share the presentation. Right. So friends, again, a very warm welcome and good IMC. So tomorrow, 29th of September, we are celebrating World Health Day, Heart Day, sorry. We are celebrating World Heart Day. And a lot of people do not understand the importance of heart. A lot of people are ignorant about heart. A lot of people have lost their life because of any diseases pertaining to heart. And today, we are going to discuss about the heart. We will talk about the anatomy. We will talk about the physiology, how heart is made, how the heart works, what are the common problems, diseases which are present, what common diseases happen with the heart. We will talk about the risk factors, and we will also talk about the solutions. So please pay attention. You can take down notes if you want to. You can sit in a place where there is no disturbance, note down things, and this presentation will help you to help more people in the marketplace, in the society who are suffering from heart diseases, different heart problems, right? So first, let us see what is the anatomy of the heart. See, to treat anything, you need to know exactly what is the structure of that thing, how it is made up of, what are the muscles it is made up of, what are the cells, how it works. So heart is one of the most important organs we humans have. Obviously, all the organs are important, starting from brain to lungs, to liver, to kidneys, to pancreas, to stomach. All the organs are important, but heart has a very, very special importance because heart is the organ which basically supplies blood and nutrition to all the other organs. So let us understand what the heart is. Now, if you see this picture, in this picture, you will understand that this is the exact way how the heart pumps, beats, or works. Now, heart is a very, very complex organ having 4 chambers. The upper chamber, 2 chambers are there, and the lower 2 chambers. The upper 2 chambers are called as atrium, and the lower 2 chambers are called as ventricle. Now, heart is divided into 2 halves, the right half and the left half. The right half is responsible for the collection of oxygen, deoxygenated blood, or you can say it is responsible to get the blood from the organs back, and the left side of the heart is responsible to pump out oxygenated blood or the fresh blood. Okay, now there are different arteries, there are different veins with which the heart pumps out the blood, and the blood comes in the heart, and the heart has its own blood supply. The heart has its own blood supply. So in this picture, you can see this is a real actual heart animation, and this is how the heart pumps every second. Now, this picture, if you see, will let you know that how does a heart pump? I mean, basically, what is the reason the heart pumps? If you see, there is an electrical impulse. Basically, the heart generates its own electricity, because of which it can beat on a normal rhythm. And this electricity is produced by the heart itself. So if there is a problem with the electrical impulse in the heart starts behaving abnormally, it starts beating abnormally, and there can be a cardiac arrest, right? So the major function of the heart is to pump the blood, and for pumping the blood, the heart, the movement which is created through a system, electrical system, which is already present in the heart. Now, this is a cut section of the heart. This is the inside of the heart. If you see, the heart, as I told you, has different chambers. So the one which you are seeing right now are the ventricles, are the lower part of the heart. And the heart is divided into left and right by a septum. There is one membrane or muscle which divides the left and the right. And there are valves which help the oxygenated and deoxygenated blood, the oxygenated and the deoxygenated blood to mix. I mean, it helps the oxygenated blood and deoxygenated blood to stay away from each other. So there are pulmonary valves. You can see on the top right side, you have the pulmonary valve. When the heart is pumping, the valve opens and the blood goes out. And the valve, because of the valve, the blood does not come back inside. Then there is a aortic valve. Just behind the pulmonary valve is a aortic valve. Then you have this bicuspid valve, also called as the mitral valve. Bicuspid means two. It has two cusps, or it has two flaps, you can say. So it is bicuspid valve. And then on the left side below, bottom, you see a tricuspid valve. So it has three cusps, three layers, you can see, or three flaps. So this is the inside of the heart, and most of the heart diseases are either due to the electrical impulse imbalance. There can be a lack of blood supply to the heart itself, which is called as coronary artery diseases. And the third major problem comes with the valves. These valves get stiffened, stenosis, and they do not close properly, and that is why the heart does not function properly. So this is the anatomy of the heart. Let us see how the blood flows in the heart. Now, medically, if you see the whole blood supply in our body, whenever you see this blood supply in the books or in any pictures or any animation, you will see that the blood supply is colored in two colors. One is blue and one is red. The blue color is the deoxygenated blood, and the red is the oxygenated blood. The blue is called the artery veins, and the red is called the arteries. Arteries carry the oxygenated blood, and the veins, the blue, carry the deoxygenated blood. Okay, so in this picture also, you will see that the coloration, the color combination is the same way. And the blue part, the blue arteries, big arteries, will get all the deoxygenated blood from different parts, from brain, from your liver, from your other system, from your kidneys, everywhere. It will collect the blood, it will pump in the heart, and the heart will again pump the blood to the lungs. The lungs will add oxygen to the blood, and it comes again to the heart, and the heart again pumps the blood back through the red pipes into the system. And this happens non-stop. This happens every second. This happens every minute. This happens every hour. This happens every day. This starts happening. Actually, this heart starts working from the 4th week of gestation. When the baby is 4th week old in the mother's womb, the heart starts developing and starts pumping. And as the baby grows in the womb, 5th month, 6th month, 8th month, the body also grows. And through that small heart, the whole body gets the blood supply in the womb also. And this heart works non-stop till the last breath. In fact, since the heart has its own electricity, you can just take out the heart and keep it outside also, and it will pump on its own. It has that much of electricity. But because of certain conditions, the heart stops working. We'll check those conditions, what happens exactly, and how we can keep our heart healthy. Right? So if you see, the major part are 2 atriums, right and left, 2 ventricles, right and left. Then you have arteries and veins which supply blood to the heart and from the heart. So if you see the diagram, you will see the arrow marks are given, that how the blood enters from blue big pipe, then it goes into the atrium, then it goes to the right ventricle, the right atrium, the right ventricle, and then it goes to the pulmonary artery, goes to the lungs, and from the lungs it comes back to the heart, the right atrium, left atrium and the left ventricle, and from left ventricle it goes to the aorta and gets distributed all over the body. So this is how the heart works with the blood flow of the body. Now, to simplify this, to understand this, you can see this diagram. Now you see the right side is totally blue. I mean, obviously it will be your left side right now, but if you see, since the picture is in front of you, your left is actually right. Like I am sitting, this is my left hand, but for me, the picture, the blue side is actually the right side. So you see, the right side is totally blue, which means all the deoxygenated blood from the system goes to the heart, the inferior vena cava and superior vena cava. These are the main 2 veins which carry the deoxygenated blood into the heart. And then from there, the blood is pumped into the pulmonary arteries. Now, this is the only place where the pulmonary artery, as I told you that arteries are always carrying oxygenated blood. But in the whole system, in the anatomy, this is the only place where the arteries are carrying deoxygenated blood, which is called as the pulmonary artery, which is in blue. Generally, the arteries are in the red color. And from the lungs, when the blood goes to the lungs will oxygenate the blood and send it through the pulmonary veins back to the left atrium and then to the left ventricle. So in this diagram, only the pulmonary artery, which should be actually in red, but technically, medically, anatomically, it is in blue, and the pulmonary vein, which generally is in blue, is in red. Rest of the body, the system is veins are in the red color and arteries are in the veins are in the blue color and arteries are in the red color. Okay, so you don't have to go that much deep. It can be confusing sometimes, but just for you to understand how intricate the system is, I'm just showing you this diagram. Okay, this is how the blood supply happens. This is how the blood is oxygenated and it goes to the organs, and deoxygenated blood comes back to the heart and then to the lungs and then again oxygenated blood comes back to the heart, and then it gets distributed to the whole system. Now, just to see the electrical capacity of the heart, you see very closely, if you see on the left hand side, there are small yellow wire kind things which are blinking, and the electrical impulse is passing, and that is how the heart is pumping. So on your right hand side, you see the diagram which is in yellow color, and different names are given. You don't have to remember memorize all these things. You should only know that the heart has its own electrical supply, and because of this only, if the heart has to work, the electrical supply or the electrical impulse has to be natural and normal. Let us see some facts of the heart. Now, the pumping power of the heart, if you see, on average, the lifetime, the pumping power of the heart is, it can pump about 1 million barrels of blood, which is enough to fill more than 3 super tanks. That much amount of blood the heart pumps in a lifetime. 1 million barrels of blood. The average heartbeat about 100,000 times a day. On an average, it beats 100,000 times a day, which means that it beats 35 million times in a year, and over a lifetime, on an average, it beats around 2.5 billion times, the heartbeat. Electricity, I was talking about electricity. The heart produces enough electrical energy each day to power a 20-watt light bulb for 24 hours. That much of electricity only the heart can produce. Just imagine, 20-watt electrical bulb for 24 hours. That amount of electricity is produced by the heart. Now, as far as distance is concerned, in a day, the blood travels a total of 12,000 miles, which is approximately 19,000 kilometers through the body. The blood travels 19,000 kilometers. If you just average the travel from heart to the feet, from heart to the brain, from heart to the hand, the blood travels almost 19,000 kilometers in a day. Just imagine. And this is because of the heart. And heart does a lifelong work. It does not stop. It does not sleep. So your heart will keep working even if it's separated from the body, because it has its own electrical impulses. I told you this thing earlier also. Now, when you are sitting idle and there is no sound, and you just keep your hands like this on your chest, you will feel a lub-dub sound, lub-dub, 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 lub-dub. Or you take a stethoscope and just keep the stethoscope and earpiece in your ear, and you hear there is a lub-dub sound. Now that lub-dub sound is because of the valves, which I showed you in the third diagram. The aortic valve, the bicuspid valve, and the tricuspid valve. When the valves open and close, it will produce a lub-dub sound. The cells of the heart, all the cells in the body can regenerate, but the cells in the heart are difficult to regenerate. And that is why once the cells in the heart start dying, it is very difficult to repair the injury. So we need to take very, very good care of our heart. Heart can stay healthy if you do enough exercise. Regular physical activity can decrease your risk of heart disease. It also helps strengthen the heart and improve blood circulation. So regular exercise is very important. If someone is having a sedentary lifestyle, they do not work out, they do not walk, their heart will become weaker. So if you want to strengthen your heart, you should make sure that you do daily walking, running, jogging, some cardio, some lifting. So it is very, very important to keep your heart muscles strong and improve the blood circulation in the body. You must have you must have heard about this heart transplant, complete heart transplant. So first heart transplant was done in the year 1967 by a doctor named Dr. Christian Barnard. He is a South African doctor. He did this total heart transplant. He took a heart from recently passed away person and replaced the heart in a patient whose heart was not working properly. So the first heart transplant was done in the year 1967. Okay, so these are some facts about the heart. Now let us talk about the diseases. Okay, another thing is there, women versus men. On an average, a woman's heart beats faster than man's heart. So females have a faster heartbeat. The heart beats faster because the size of the heart of a woman is smaller. Anatomically, if you see, the size is a bit smaller and the male's heart is slightly bigger. And because of which the heart has to pump faster because it has to push more blood. And that is why women's heart beats faster. Now let us see a few diseases with which a human being can suffer, the heart diseases. The first disease is the valvular disease. I told you earlier that there is a stenosis or thickening of the walls. So if you see the top right picture, the first picture, the normal valve is properly closed, but a stenosis, there is a small gap and through which the blood can pass, which is dangerous. The second common problem is aneurysm. The arteries bulge out and the blood starts collecting there, putting more pressure on the heart, putting more pressure on the muscles, and it can be fatal. Another disease very common is cardiac arrhythmias. Now, cardiac arrhythmias occur because of improper electrical signals, disorganized electrical signals. So there are two nodes, SA node and AV node. SA node is sinoatrial node and AV node is atrioventricular node. So there are two, you can say they are small batteries. There are not actually batteries, but for your understanding, you just understand that they are small cells or batteries because of which these electrical impulses are generated. And whenever these batteries malfunction, the electrical impulse does not go and properly and the heart starts fluttering. The arrhythmias come. Arrhythmias are like your heart is in a rhythm, lub dub, lub dub, lub dub, lub dub, lub dub. But arrhythmias will be lub lub dub, lub lub dub, lub lub dub dub, lub lub dub 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 dub, lub lub dub dub. This rhythm is missed because of improper signal, improper electrical signals. The bottom, if you see, is thickening of the myocardium. So myocardium is the myocardium means the muscle of the heart. So the myocardium, because of inflammation, becomes thicker, and it becomes very difficult for the heart to create a proper rhythm. It cannot push the blood properly. Then you see pericarditis. Pericarditis, every organ is covered with a thin layer. Now this layer, whenever there is inflammation in this layer, it is called as pericarditis. And because of which patient can have symptoms of breathlessness, unusual pain, difficulty in breathing. Slight walking will also create some pain. All these things will happen. There can be accumulation of fluid in the body. Then the next is heart failure. What happens is, as I told you earlier, there are 4 chambers, 2 atrium and 2 ventricles. Ventricles are the bottom chambers. So the bottom chambers become dilated. They become bigger. And when they become bigger, the heart, it becomes difficult for the heart to pump the blood. And the heart becomes exhausted, and there can be a heart failure. And then there is a very, very common disease, which is called as artery disease, coronary artery disease, CAD, where there is accumulation of fats in the arteries, because of which the heart itself cannot get proper blood, and because of which the heart stops working and a person can die. So these are common heart problems faced by human beings. There are many more, but these are the most common. Now, let us see what are the risk factors. Before that, we will see what are the symptoms of, early symptoms of heart attack. Early symptoms of heart attack or heart diseases are dizziness, vertigo. Then it also, if the dizziness is prolonged, then it can also lead to vomiting sensation. It can produce vomiting. Then there can be pain in the shoulders or in the back. There can be pain, continuous pain, uneasiness. Then there can be pain in the chest while you are walking, or while you are doing some activity, or while you are at rest also. There can be some uneasiness, there can be breathlessness. Small steps, 4-5 steps can cause breathlessness. So these are early symptoms of some cardiac problem or some cardiac diseases. Now, what are the risk factors? Let us see some risk factors which can cause severe heart problems or some heart disease. Number 1 is high blood pressure. Anyone who is having high blood pressure. What is high blood pressure? Blood pressure is measured in 2 ways, or blood pressure has 2 units, the systolic unit and the diastolic unit. Diastole means when the heart is opening up and the blood is filling inside the heart. It is called as diastolic. And systolic means when the heart is pumping the blood outside. It is called as systole and diastole. Systole, diastole, systole, diastole. Diastole is when the blood enters the heart, and systole is when the blood goes out of the heart. So the pressure is measured in 2 ways: systolic blood pressure, diastolic blood pressure. Normal pressure is 120 systolic, 80 diastolic. 120 systolic and 80 diastolic is normal. But anyone who is having 140, 150 systolic, 90, 95, 100 diastolic is having blood pressure, which is on a continuous mode, then it is termed as the person is having hypertension. So hypertension or high blood pressure is one risk factor for heart disease. Age. The more you age, the heart starts getting weaker. So age is one factor. Then a lot of stress. The stress can be environmental stress, mental stress, the kind of stress we put on our bodies through food. Any kind of stress, oxidative stress, can have a bad effect on the heart and cause heart disease. Then is obesity. Anyone who is overweight, too fat, the heart has to pump a lot of blood and it can cause heart problems. Then comes high cholesterol. Anyone who is having high triglycerides, high cholesterol, high LDL, low density lipoprotein, high VLDL, very low density lipoprotein. So their arteries can get clogged by fat and the blood supply to the heart can be diminished and they are more prone to heart diseases. Then diabetes. Diabetes is one of the major reasons for heart problems. Atherosclerosis. This is one of the major reasons. Genetic. It can be genetic if your parents, your grandparents were having heart problems. You are prone to have a heart problem. Chances are more. Then sex. So males are more prone to have heart attacks or heart problems than females. Generally, females get lower, the rate of heart attacks are lower in females, but rate of heart attacks or heart problems are more in males compared to females. Smoking is one risk factor. If you are smoking, you are going to damage your heart and chances of getting artery blockages are more. The arteries become stiffened, the arteries become clogged, and it can cause heart attack. Unhealthy diet, junk foods, oily food, too much of butter, too much of dairy, too much of meat, too much of red meat can cause heart problems. Poor dental health can also cause heart problems. If you're not brushing your teeth properly, if your teeth are not healthy, if your mouth is not healthy, you are going to get heart problems. So how we can prevent? What are the preventions? So keep a healthy weight. First of all, check your weight. There is a simple way you can keep a check on your weight. Your height in centimeters, whatever is your height in centimeters, minus 100 should be your ideal weight. If your height is 180 centimeters, minus 100 is 80. That is 80 kgs is your ideal weight. If your height is say 175 centimeters, minus 100, 75 kgs should be your ideal weight. If your height is say 160 centimeters, minus 100, 160 minus 100 is 60. 60 kgs is your ideal weight. So keep a healthy weight. Check your blood pressure after a certain age. You should regularly check your blood pressure. After 40s, you should regularly check your blood pressure. Regularly monitor your cholesterol levels, triglyceride levels. If you are smoking, don't smoke. Stop smoking. If you are diabetic, manage your diabetes. Eat healthy. Eat more fruits. Eat more vegetables. Eat meat in limitation. Eat fish more if you are non-veg. Eat white meat. White meat is better than red meat. Stay active. Do cycling, exercise. Do some cardio, do some aerobics, do some yoga. And proper nutrition and medication. These are the things which you should do to prevent any severe heart problems. Now, let us check what is the condition in Malaysia. Now, if you see, the condition in Malaysia is pretty bad. On your screen right now, I am sharing with you 10 principal causes of death in Malaysia. Which are the 10 most common reasons for death in Malaysia? And this infographic or this statistic is from the Malaysian Health Ministry website, and this is of 2021. So we're just 2 years ahead. If you see, 17%, the highest death in Malaysia, in Malaysian population, is because of ischemic heart disease. What is ischemia? Lack of blood supply to the heart itself. Also called as IHD, ischemic heart disease. 17% of the deaths. So if 100 people are dying, 17 people are dying of heart disease, ischemic heart disease, coronary artery disease, atherosclerosis, cardiac arrest, heart attacks. 11% people are dying because of some lung disorder, some pneumonia or something of that sort. 8% are dying because of cerebrovascular disease, blood supply lacking in the brain, or some problem, some clog in the brain, some embolus in the brain, some lack of blood supply to the brain, stroke, paralysis. And then 2.2% is transport accidents, then chronic respiratory diseases 2.1, then diabetes mellitus is 2.0, 2.5 is some cancer, 2% is some very grave cancer of colon or rectum or anus, and so on. So if you see, 17% of people are losing their lives because of a heart problem. So ischemic heart disease, if you see total 18,515 ischemic heart diseases deaths in Malaysia in 2021. Out of that, 12,707, which is equal to almost 69%, are males, and 5,808, which is 31% approximately, are females. As I told you earlier, that males are more prone to heart diseases and heart attacks. So now we need to be careful with our heart. If you do not have any problem, doesn't matter. You don't think that you will not get any problem. The best thing is prevention. The best thing is to take the right steps now, today. Don't wait for any problem to come. It is better if your heart is fine right now, healthy right now, let it be healthy by doing certain things, by accepting certain disciplines, right? Now, if you see, this is a paper cutting from Malaysia, and heart disease kills 50 Malaysians every day. 50 Malaysians every day are losing their lives because of some heart problem. And the most common is coronary artery disease, ischemic heart diseases, very common. Now, can we stop this? Can we prevent our family, our loved ones from getting any heart diseases? The answer is yes. What do? Stay active, do walking, running, take care of your diet, lose all bad habits, and take proper nutrition, take proper diet, take proper tonics for the heart. Because after a certain age, after 40s, you are going to get some or the other issues. Some stress is there, financial stress is there, family related stress is there. All these stresses take a toll on your heart. Your heart starts getting weaker. Your heart needs some strength. So exercise, good food, good diet, yoga, all these things will definitely help. But with that, you need some products. Now, these products can be used as preventive as well as a management also. You can use these products if you do not have any heart problem, and you can also use these products if someone is having heart problem, and to manage their heart related issues, you can use these products. What are they? Let us see. First is Botanical Beverage Mix Noni and Aloe Vera. Now, Noni has high amount of potassium. It has magnesium. Noni is very, very good for lowering blood pressure. Noni is very good in antioxidants. So it will reduce the free radicals. It will reduce the oxidative stress. Noni helps to reduce the cholesterol levels. Noni helps to strengthen the heart muscles. Noni is very, very good for digestion also. It helps improve the liver. It is hepatoprotective. It protects the liver also. So Noni has several other benefits, but we are right now talking mostly about the heart, benefits towards the heart. So Noni helps to reduce the blood pressure. And as I told you earlier, that one of the major risk factors is high blood pressure. Second product is sea buckthorn. Now, sea buckthorn is very high on vitamin C. So vitamin C is very useful in reducing the inflammation. So any inflammation in the heart, near the heart, inside the heart can be reduced if you are taking sea buckthorn. The arteries which stiffen, or the arteries which become smaller, the lumen becomes smaller, is because of inflammation in the arteries. And that is why the blood does not reach the heart properly. And that is ischemia. So it reduces inflammation, it reduces pericarditis, it reduces the myocardium, what do you call it? The size of the heart. If it is enlarged, it will reduce that. It will help to elevate the aneurysm. One thing important I forgot in Noni is, Noni has natural nitric oxide in it. Noni has natural nitric oxide, and nitric oxide is responsible for keeping our arteries intact. The lumen of the artery, if it is this much, it will help to keep the lumen this much only. If the nitric oxide reduces, the arteries start to compress. It shrinks, the lumen shrinks. So nitric oxide will keep the arteries lumen intact. So that is important thing. So Noni should be taken, if you are healthy also, take 30 ml every day. But if someone is having problem, you can give Noni 30 ml morning, 30 ml in the evening or night. As far as sea buckthorn is concerned, sea buckthorn has omega-3, 6 and 9, which is very good for heart. It is good for keeping the BP under control. It is very effective in cleaning the kidneys. So if the kidneys are functioning well, your blood pressure also stays under control. And sea buckthorn, as I told you, is very, very good for the muscles of the heart. It is a tonic to the heart muscles. It helps to reduce the stenosis in the valves. So if there is a valvular disease also, you can recommend sea buckthorn. Sea buckthorn dosage is 30 ml. If you are healthy, every day you can take 30 ml. But if you want to recommend it to your patient, you can give 30 ml morning and 30 ml in the evening. Then we have this botanical beverage, turmeric and saffron. Turmeric has a very, very important active molecule called as curcumin. It is a very good antioxidant. It reduces the oxidative stress. It reduces inflammation. It helps to repair the damaged arteries. It reduces the cholesterol levels. It reduces the triglyceride levels, the LDL levels, and it will help to reduce any blockage if it is there in the arteries. And by that, the chances of heart attacks come down. So if you're healthy, take 3 drops 3 times a day with water and your heart will be fine. If you want to give it to a patient, you can give 5 drops 3 times every day. It can be mixed with sea buckthorn and noni also. Saffron and turmeric can be mixed with noni and saffron, and you can take together. Next product is Botanical Beverage Aloe Vera. Botanical Beverage Aloe Vera is basically to help you cleanse the body. It is a detoxifier. Because of a lot of toxins in our body, there is a lot of oxidative stress, there is a lot of inflammation, there is a lot of free radicals in the body. The kind of food we eat, the kind of water we drink, the kind of air we breathe, it totally creates an environment of toxin in our body. So aloe vera helps to detoxify our body, and aloe vera is very, very good for people who are having diabetes. So as I told you that diabetes is a risk factor for heart patients. So it will help to reduce the blood sugar levels also and detoxify the body, making the body much more cleaner and rejuvenate the body cells. And if the liver is healthy, detoxified, it will help the blood to flow properly without any cholesterol molecules, excess molecules, which will in turn not block the arteries of the heart. Then we have this wonderful product called as Botanical Beverage Basil. Before going to Basil, the dose of aloe vera should be 30 ml every day in the night with a lot of water. Make sure that you drink a lot of water. If you are taking aloe vera 30 ml, make sure that you take almost 5 times the quantity of aloe vera. So if you are drinking 30 ml aloe vera, make sure you add 150 to 180 ml of water and drink it. So every day night you can, before going to the bed, you can drink aloe vera, or you can take aloe vera in the morning also, 30 ml. Botanical Beverage Basil, it is a combination of 5 types of basil, and basil is considered to be a very, very good product for the heart, for the arteries of the heart. It reduces cholesterol, it reduces triglycerides, it reduces LDL. It helps to improve the detoxification through kidneys. It helps to create more antioxidants in the body, and that is why it helps to kill all the free radicals. It removes the free radicals. So basil is an important product for anyone who is having heart problem, any blockages, any valvular diseases, any inflammatory diseases, and basil also is anti-inflammatory. So anyone who is having pericarditis or myocardial infarction or any coronary artery diseases, they can be suggested basil. If you are healthy, take 3 drops 3 times a day with water. You can mix basil and turmeric and drink it together with warm water. Absolutely fine, no issues. And if someone has a condition, you can suggest them 5 drops 3 times a day. Then you have this another wonderful product called flaxseed. A flaxseed is rich in fiber. It is rich in omega-3, 6, 9, and it helps to reduce the blood pressure. It helps to strengthen the heart muscles, the valves of the heart. It helps to reduce cholesterol levels. Basically, it is another very good tonic for the heart. Now, all these 5 products: noni, sea buckthorn, turmeric, aloe vera, and basil can be mixed together, and you can drink it together, no problems. Some patients or some individuals who are not having any health problems might feel a bit hot after taking this combination. They might feel that the body is getting heated up. It is absolutely normal. It is a response, normal recovery response. Your metabolism is improving. Some people might get some loose motions also. That is also normal. Some people might get more sweating. That is also normal. So don't have to worry. After you consume these products, you will get these symptoms, but these symptoms will fade away within 2 to 3 days, maximum 4 to 5 days. Nothing to worry. Some people might start getting pains. It is absolutely normal. Nothing to worry. Don't stop the products. Just continue, and your body will get accustomed to it, and it will start working in the proper way. And these signs in itself show that your body is responding. The products are working on your body. Okay. Now, this is a combination for heart. Now, considering that Malaysia is a very huge market for heart, a lot of patients are there who are having heart problems, or there is a rise in the heart diseases in Malaysia. The company has come out with another great product, which is an ancient Ayurveda wisdom for cardiovascular health. And the product name is Botanical Beverage Arjuna with black grape and jaggery. It's a fantastic product. I mean, it is a huge hit product in India. I will tell you more about this thing. Now, what are the active compounds in Arjuna? Arjuna is a bark. Arjuna is a tree, and it is the medicines are made from the bark of the tree. And the active compounds are triterpenoids, flavonoids, tannins, saponins, phytosterols. Arjuna also has natural calcium, magnesium, zinc, and copper, and coenzyme Q10. It's a very important enzyme to keep our heart healthy. A lot of people take coenzyme in the form of supplements. A lot of heart patients are recommended by their cardiologists to take coenzyme. So basically, coenzyme starts depleting in our body after age 35. So anyone who is about 35, 36, they should definitely take Arjuna Rishtha every day, this botanical beverage Arjuna. So these are the active compounds because of which the heart stays healthy. These are the active molecules present in Arjuna, like arjunic acid, arjungenin, arjun glycosides, arjunone, arjunolone, luteolone, quercetin, ellagic acid, elagitanins, beta-sterol. All these things are responsible for great heart health. Now let us go and see deeper into what are the benefits of Arjuna. Now, Arjuna is basically a heart tonic. If you want your heart to be like a youngster's heart, like a heart of 25, 28-year-old, 20-year-old, you should have Arjuna every day, 30 ml without fail. So traditionally, Arjuna has been used as a heart tonic, and studies have indicated that its efficacy in improving the cardiac muscle function. It improves the muscle function of the heart. And if the muscle is strong, the pumping activity is better. Another important thing is Arjuna is having an anti-ischemic property. As I told you that 17% of the people in Malaysia are dying because of ischemic heart disease. What is ischemia? lack of blood supply to the cell or to that organ. When there is lack of blood supply, the part where the blood supply is less, it starts dying. And the process is called as ischemia. So Arjuna has an anti-ischemic property. It helps protecting the heart tissues from damage caused by ischemia. If there is an ischemia also, because of Arjuna, because of the flavonoids, because of the tannins, because of saponin, because of the different acids, because of beta sterol present in Arjuna, it does not let the damage happen very fast, or it slows down the damage, or it stops the damage which is caused by lack of blood supply to the heart muscles. The third important benefit is anti-hypertensive. So, as I told you that Arjuna also has high amount of potassium and magnesium. So potassium helps to reduce the blood pressure. So anyone who is having blood pressure, high blood pressure, hypertension, the blood pressure will be controlled because of Arjuna. And if the blood pressure is under control, if it is around in the range of 120, 180, 130, 90, you're fine. Your heart is not at strain. Your heart does not have to work hard. Another thing is, the fourth important benefit is, it is a lipid modulator. So it helps to reduce the levels of total cholesterol, LDL, and triglycerides, and helps improve the HDL cholesterol. So the active compounds present in Arjuna lower down the LDL, which is bad cholesterol, and push up the good cholesterol, which is HDL, high density lipoprotein. So Arjuna has this lipid modulating capacity also, and that is why it is considered to be the tonic for the heart, the best product for the heart, the best herb for the heart. Now in this botanical beverage Arjuna, we have also added black grape. Now black grapes have a very, very important active compound which is called as resveratrol. Resveratrol, sorry, I told it in the pronunciation was wrong. Resveratrol. Resveratrol is very, very good for improving the heart health. There have been hundreds and hundreds of researches done by cardiologists, scientists, nutritionists regarding the black grape. And this resveratrol ingredient, active compound in black grape, is considered to be very, very helpful in heart health, because what it does is it helps to improve the inner lining of the blood vessel. Now, why does this inflammation and blockage of this vessel happen? Because the inner lining of the blood vessel, the lumen, inner lumen of the blood vessel starts to inflame. There is some wear and tear. But because of this black grape, resveratrol, the inner lining stays healthy. It improves the health of the lining of the blood vessel, and chances of this lumen becoming inflamed and stricture forming lower down, and the blood supply is intact in the blood vessel. The blockage does not happen and your heart stays healthy. Another thing which black grape helps in is reducing the blood pressure. Black grape also naturally has potassium in it, and that is why it helps to reduce the blood pressure levels. By reducing the blood pressure, it not only helps the kidneys, but it also helps the heart function properly. Black grape is known for cholesterol content, cholesterol control. The antioxidants present in the black grapes help reduce the LDL level and the oxidation process which occurs due to LDL cholesterol. And this LDL is the main reason for atherosclerosis. Atherosclerosis is nothing but blockage in the arteries of the heart. The medical name is called as atherosclerosis. And black grapes has this antioxidant quality which reduces the oxidation which happens due to the LDL cholesterol, which leads to atherosclerosis. So these two very important key ingredients are added in this new launch product, which will be available very soon. It is on the way. It should be available within this week. I am hopeful. So whether you are having a heart problem or not, does not matter. Drink this every day, 30 ml, without fail. Without fail. Drink this every day. If you are a smoker, drink it. If you are above 40, drink it. If you are having BP, drink it. If your parents were having heart problems and they passed away because of heart problems, you should drink it. If you are into a lot of stress, if you are into a lot of financial stress, you are thinking a lot, because the mind, the brain and the heart is connected. If your mind is in a lot of stress, it is going to affect your heart. So if you have a lot of stress, drink it. If you are eating too much of junk food, if your diet is very high on calories, very high on carbohydrates, drink it. If you are diabetic, take this product 30 ml every day. So if you see overall, it helps to reduce the stress, it helps to reduce control blood pressure, it strengthens the heart muscles and regularizes the heartbeat. Anyone who is having arterial fibrillations or tachycardia or bradycardia, low heart beats, fast heartbeats, cardiac arrhythmias, this product is going to help you. Anyone who is having chest discomfort, breathing disorder, this product is going to help them. And this product is launched in Malaysia. The price of this product is, the retail price is 94, the associate price is 72 ringgit, and the business volume is 32.4. In East Malaysia, the retail price is 100 ringgit 50 cents, and associate price is 77, and business volume is 32.40. So this is about the heart, and this is about the product. Okay, so this is all about in today's presentation. If you have any questions, you can mention it down in the chat box. If mixed together, how many ml of water? Around 250 ml of water. If you are mixing noni, sea buckthorn and aloe vera, you can add 250 ml of water slowly and steadily. Slowly, you can add water and keep on drinking. If a person have 3 stents in their heart, can they drink Arjuna? Yes, you can drink Arjuna. If you are having a stent, 1 stent, 2 stent, you can drink Arjuna, no issues. It is absolutely safe. It will improve the heart health. Okay. Another thing, what I find is a lot of people are getting results. A lot of people, when they're giving the products to their loved ones or their family members, they're getting results. But they are, I don't know, somehow shy in discussing it, or shy in sharing the results. Please understand that this mission is about sharing things. You do not share things, people will not come to know. So I would like to invite people who have been giving products to people. You see, we have been in the market for the past nine months, and I'm sure that hundreds and thousands of people have been using our products. So if you have any results to share, please unmute and share the result, the testimony. The testimony is very important. If you do not share the testimony, you are stopping your own growth, I would say. Sharafat, thanks. Before food or after food? One. You can take this before food. Before food is okay. You can take it after food also, because see, I'll tell you one thing. These are all before or after, doesn't matter. All our products are, they are all food. They're all food supplements. So that is why you can take it after food also or before food. Just keep a gap of say half an hour. That's okay, I suppose. Anyone wants to share any testimony? I would like to welcome them. Please raise your hands and you can share the testimony. Anyone wants to share testimony, please raise your hand. Come on. I know, I mean, I get a lot of testimonies. People will message me, sir, I got a very good result. All those things. Fine. You are sending me messages. But what's wrong when you are told to tell it on the on a live? Are you scared? Or after 2 months, they can stop or need to continue? They should continue. I mean, if they want their health to improve, if they want their heart condition to be fine, because 2 months, if you compare 2 months with another 20 years, if someone wants to live more 20, 25, 30 years, I mean, they should take it, because for another 20, 25 years, the stress will be there. The pollution is there. The oxidative stress is there. So as I told you that if you're healthy, then also you take it. It's like food, but this is a concentrated food, which is having all the good qualities, all the minerals, vitamins, all the medicinal qualities, which we do not get in our traditional normal food, right? See, I've been taking this sea buckthorn. It is always near my table. Aloe vera, noni. It is always where I sit every day in the morning. I'll mix all these products and I'll drink it. I use all these products, you see. This basil, it's always near me only, where I'm sitting on my table. See this? All these things I take every day, mix them all, put the water and drink it. First thing in the morning. We have this 6 a.m. club morning meetings every day we do. Morning, 500 people come and join this. Every day I'm doing it. First thing we do is we will mix the whole 5-6 products and drink it all together. 500 people drink all together. Now they are drinking it at their home. I am drinking in my home. So and this I've been taking for the past maybe 9 years, I guess. Every day I'm taking this for the past 9 years. Can you believe it? And people ask me, sir, you look very young, you look very energetic. What is the reason? I say, this is because of these products. They don't make me fall sick. I'm always active. I'm 25 days traveling. I'm talking on the stage for 5 hours, 6 hours. Doesn't happen anything. My energy is always on the high. Can Arjuna replace atorvastatin type of medication and blood pressure tablets so that patient stop consuming? Yes, it can, but immediately you should not stop. You have to take it for some time, and slowly, once the cholesterol levels, once the triglyceride levels, LDL levels are under control, then slowly the products can be tapered off. You can take it, no problem. You can taper it off. When taking IMC, we still need to continue hospital medicine. Yes, I told you that immediately you cannot stop the medications, because all these allopathic medicines or modern medicines, the patient's body is used to it. If you stop them immediately, the patient might get a withdrawal effect. Something untoward can happen. So the allopathy medicines along with IMC products continue together. Once the condition is improving, the allopathic medicines can slowly be tapered off, and you can continue with these products. Yes, you can ask a question. Ting tang. Ting tiam tang. You want to ask a question? You want me to unmute you? Okay.
Okay. Dr. Leke, I want to ask a question because you have mentioned a few times, right? When we take aloe vera or sea bottom, we need to add in examples 30 ml of aloe vera. I will put in 100 to 150 water, right?
Yeah.
Okay, if we mix together, let's say four type aloe vera, roni, sea bottom, and this Vijaysa, let's say we mix together. Is it the water still the same 150 ml or I need to
You have
have
to increase the quantity.
300 ml water? Pardon?
Aloe vera is 150 ml. For every 30 ml of other juice like sea buckthorn or for Vijaysa, you can add another 30 to 50 ml of water for those things. So as a whole, you can add 250 ml of water. That is what I told.
Per type.
30 ml of aloe vera plus 150 ml of water. 30 ml of sea buckthorn, add 50 ml of water. 30 ml of Vijaysa, add 50 ml of water. So this 3 drinks plus 250 ml of water.
Then it will be about 200 ml of water already, right?
Yeah.
Okay. Because just to clarify that part, I think otherwise, I think the water we consume, we mixing a bit less.
Drink it immediately at once. You can drink it in a span of say 15-20 minutes. That is how I drink. What I do is I'll take warm water. I make a combination in a glass, and then I will add the water to the brim, to the top, mix it and take 2 sips. Then again add some water.
I see.
The top. Mix it, again take. Again, once after 2 sips, again I add water. And then, so like that I will add. I don't take a glass or a jug which is 500 ml. I take
a put in all of it.
Yeah. That is how I drink. I hope this answers the question.
No, that is very important to affect the effectiveness.
Yeah.
Okay, I want to share one testimony. That was I heard this afternoon from one of my associates. She went to approach the lady. We found difficult to sleep. Found very difficult to sleep. Then he just prescribed the aloe vera, Basil, Turmeric, and even with stevia. 3 type and add in the aloe vera. And secondly, the woman feedback to him from non able to sleep. Then the whole night she sleep very well until morning 11 a.m. still not wake up yet.
Wow.
Immediate on the same day happen,
Great.
Right? Which I think is very amazing.
Thank you very much for sharing. Thank you so much. Thank you for showing the big heart of sharing. Thank you so much. God bless you and God bless the patient. Thank you so much. So similarly, anyone who is having any testimony, please come forward like Dr. Tan. He's a great associate. He's been working very hard and his energy always motivates me, inspires me. So thank you, Dr. Tan, for sharing. Anyone else wants to share any feedback, any testimony? If they have been using the product, they've got any results, or if they have recommended to anyone. If you've got a testimony from someone else, please share it so that we can share it. This testimony can help a lot of people, you see. So anyone who is having any testimony, please come forward. It is not necessary that you have to speak in English. You can speak in your mother tongue, whether it is Malay, you can speak in Chinese, you can speak in Tamil, whichever language you want to. It is not that you have to only speak in English. So anyone having any testimony, please come forward. No testimonies? Okay, any other questions if you have, you can ask me. Question is regarding aloe vera botanical beverage. No need. Understand its detox. How does it relates to diabetes? How does it relate to diabetes? So it is a huge chapter, and when I take a session on diabetes, I will tell you about how it works on diabetes. There are different active ingredients in aloe vera, which when work on the cells, it helps to lower down the sugar levels. It helps to improve the insulin production. It reduces the insulin resistance. So that is how it reduces the blood sugar levels and helps in diabetes. So it's a huge big class. So when I'll talk about diabetes, I'll definitely share about that. Can we make can we take aloe vera without mixing? No, you have to take aloe vera with water, because if you take aloe vera without water, you will feel very uneasy in the stomach. See, aloe vera is like soap. The way we take bath, we apply water first and then we apply soap on the body. Now, after applying soap, just imagine you do not rinse it with the water again. What will happen? Your body will feel sticky. Your body will feel, your skin will start feeling very awkward. So aloe vera has an active molecule called saponin. Saponin means soap. So if you drink aloe vera, it works like a soap in your intestine. It cleanses everything. After cleansing, if you do not put water, it is not able to throw it out from the system. So aloe vera has to be taken with water. That is a compulsion. What is the best for uterine fibroids? What is needed to increase hemoglobin? To increase hemoglobin, you can use noni and sea buckthorn. Very good for improving hemoglobin. For uterine fibroids, you can use sea buckthorn, turmeric, saffron, and basil. It will work very well for uterine fibroids. If a person have white cell count high, can I recommend noni, or what else to add? White blood cells, if they are high, that means there is some infection in the body. So we need to know what kind of infection is there, which organ is affected. But for high white blood cells, you can always give green tea is good. You can give sea buckthorn. You can give basil and turmeric. Okay, so I guess we are done. No one has anything to share. So friends, myself, Dr. Anand Bajpai and Dr. Prem Kumar, we are coming to Malaysia on 7th of October. So we will be planning a few meetings. We'll be planning few leadership meetings. We'll be talking a lot about leadership, because now the team is growing, and if we want our team to grow further, we need to learn and teach leadership. Without leadership, the team is going to not grow further. So we'll be organizing a few leadership meetings. We'll be organizing few product training sessions in different parts of Malaysia. So you can talk to your uplines, and maybe you can talk to DJ, and we can arrange a few meetings in different parts of Malaysia, North Malaysia, South Malaysia. We can do it in East Malaysia. All those places we can do. So I'm very excited to meet you all. And another new product is going to come. That product also I'll be teaching you all very soon. So we are coming up with new products, and I'm very happy that I can see a lot of new leadership coming up. People are achieving new levels, and people are doing very good right now in Malaysia. So We have 2 more days for the closing. Today, 20th, almost done. 29th and 30th is our business closing. So please make sure that you are maintaining all your legs and all your side volume and all those things, and you are achieving your targets. Langkawi, I suppose next month is the last month for achieving Langkawi. Langkawi is going to be a very, very awesome trip. And I'm hopeful that a lot of people are also putting their efforts to achieve India. There is an India trip which is there, and we want maximum people to come to India, visit our factory, visit our head office. So I'm sure that you all are aware of what is the offer for Malaysia, India also. So please, if you have any questions, you please be very, very feel free to call me. You can talk to Money, you can talk to DJ, you can message us if you have any questions or queries. So all the very best to all of you, and your feedback, your suggestions are very important. Any feedbacks you have, any suggestions you have regarding any products, regarding system, regarding trainings, regarding any part, anywhere we can help you as a leadership, as management, please feel free to talk to us, to let us know. Any challenges you have, you let us know, so that we can do our best to solve those challenges. Right? So thank you once again for joining, and we'll see you very soon. Thank you. God bless you. I guess DJ is there. DJ, you want to say anything?
Good IMC doctor. Thank you so much for wonderful presentation. And I think today the product which doctor discussed is Arjuna Rishtha. And this is one product which is very, very, very popular in India. And I think by Monday or Tuesday, I'm not confirming the day, but within next 2-3 days, this product should be available in office. Along with this 2 product, sir, have you discussed the other 2 products also?
No, I have only discussed Arjuna Rishtha.
Only this product. Apart from this, there are 2 other products which are coming. One is for gastritis, for any issue related to your stomach, moreover related to your digestion and gastric problem. And 3 products, I don't want to discuss that, but 3 new products are coming in your product category. And so that's it. Thank you so much, doctor. And I think
DJ, there is one participant who wants to share. Uy is there. Uy, I'm unmuting you. You can share in whatever language is comfortable for you. She has Uy has a testimony, so we would want to hear from you. Uy, you can unmute and you can share in Chinese or whichever Mandarin or whichever language you want to share. Please come forward. Can we have a round of applause for Uy? She wants to. Come on, Uy, come on. You can unmute and speak.
OK，
Wow. So,
Dr. Tan，等一下你翻译啊。我
just
有
hold
一
on. Uy, if you can
Florence, is
also
it
switch
Florence?
off the camera so that this is recording. We are recording. So we'll just, it would be great if you can just switch on the camera if it is comfortable for you.
OK， Doctor, maybe
Is it-
when I speak the Chinese, then maybe
Please.
is it the Dr. Tan there? Maybe he can translate a bit lah. Huh? OK，
Okay, Florence, Dr. Tan can do.
OK，
no problem.
我很感谢就是 IMC 的这个 product 哈，因为它真的是帮助我个人就是因为我本身有这个那个血我的血压一向都是很低的，所以当我这个血压很低的时候，我就算吃很多的 product， 它好了又再来，但是借着这一个的 IMC 的时候它就彻底的来解决我这一个的问题，所以到目前就是我整个但是我用的时间蛮长，差不多3个月到4个月，可是 过了这一段那个时间的时候哈，都给我完全的回复啦，就是再也没有这种晕那种的现象。这个是我第一个，所以所有的 product 我都在使用，也帮助我得到健康的身体，也帮助我在这个呃就是这个我的那个 immune system 能够很好的去呃有很好的 result 啦，OK 然后第二个呢，就是我有一个朋友是我在米瑞，他其实是已经coma 了，活过来，可是2年的时间哦，当我见他的时候，他非常整个身体是僵硬的，是很难就是说手脚很难打开。可是自从我们我只是给他吃第一次，然后就是给他我们的那个 Basil 跟我们的那个 Turmeric，喝了之后，他的双手脚可以很轻松的去打开，而且很 relax 所以我只给他这一次而已，然后当我就看到，然后他的家人也看到，然后第二天我再去见他的时候，我只单单给他就是turmeric 跟那个 basil， 还有掺这个我们的那个 saffron 就是那个藏红花跟我们的那个西巴顿给他的时候所以他现在他的整个身体完全就是说没有像那种好像僵尸的僵硬所以他整个人的身心灵就是好像很轻松这样，但是他不会讲话所以我就觉得很惊讶啦。这个也是他的家人也是看到，所以我叫他的家人继续给他吃我们的这个产品，就是 turmeric 跟这一个basil 还有西巴顿，就是这样，谢谢。
OK Foreign 你本身是什么 product 啊？
我自己本身就是我有 saffron， 我也是有吃那个西巴顿，但是最初的时候我是那2个小瓶的，那个2个小瓶，但我没有加那个stevia，然后还有就是我那个 aloe vera。
Okay, basically Florence Uy from Kuching, our superstar in Kuching, right? She want to thanks very much to IMC product. Okay, she got two cases to share lah. First case is herself, right? All the while she suffered low blood pressure, right? Low blood pressure, then he feel giddiness, right? He feel tired most of the time lah. Then after consuming IMC products of stevia, basil, not stevia, sorry, turmeric, basil, and saffron, of course, with aloe vera and cibaton, But of course, after about 3 to 4 months, right? Now she almost fully solved this low blood pressure problem, right? And she feel very happy, and she feel very thankful to IMC products. And second case, she want to share is one of the this friend in this Simiri, right? Recover from coma, after coma, recover, right? But for the last 2 years, this patient basically cannot move, and the whole body is very stiff, The whole very stiff, cannot move, even the hand cannot open up. But she just try give a stimulate and basil for her to try, right? Her body, the hand and the body become softer, right? Then of course now she give turmeric, basil, saffron, and aloe vera and cibaton together, and wish the family can continue to let her drink a thing. Even though now this patient still cannot talk, but the body is a lot improvement, not like last time like zombie, right? Now it's no more now it's more like human being, Okay, so this is basically the 2 cases shared by Florence. So that's it. Thank you, Florence.
Thank you very much. Thank you, Florence, and thank you, Dr. Tan, for sharing. So we will conclude this meeting for today, and we will see you all very soon. Thank you once again for joining. Take care. Bye bye. Good IMC. Love from.
Okay, bye bye. Good MC.
Take care.
Bye bye.